Hi friends, once again welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB Nursing Superintendent exam. Also these questions will helpful for your MHSRB Telangana Nursing Officer exam and other nursing officer exam. We are discussing one previous year question paper and its answers. First 50 questions we already completed and today we can see next 25 questions. First question, which of the following hormone is responsible for milk production by the alveolar epithelial cells? And our options, option A oxytocin, option B estrogen, option C progesterone, option D prolactin. Our question is, which hormone is responsible for milk production? And the correct answer is option D, prolactin. Prolactin is responsible for milk production by the alveolar epithelial cells, and first option oxytocin is responsible for milk ejection. This is milk production. Oxytocin help for milk ejection hormone. Move on to the next question. Which of the following characteristics would be expected while performing a neurodevelopmental assessment on a 3-month-old infant? Options. Option A strong Moro reflex. Option B, a strong parachute reflex. Option C, rolling from front to back. Option D, lifting of head and chest when prone. The question is, which findings we can expect while doing neurodevelopmental assessment on a 3-month-old infant? We can expect lifting of head and chest when prone. Option D is the correct answer. Move on to the next question. The presence of maternal polyhydramnios and single umbilical artery is a warning for. Options. Option A, imperforate anus. Option B, diaphragmatic hernia. Option C, atresia of upper digestive tract. Option D, atresia of lower digestive tract. Our question is maternal polyhydramnios. Polyhydramnios means excess amniotic fluid, and single umbilical artery is a warning sign for atresia of upper digestive tract. Option C is the correct answer. Move on to the next question. Which one of the following condition is suspected in a neonate with history of frothing following feeds? Options. Option A, diaphragmatic hernia. Option B, tracheoesophageal fistula. Option C, bronchopulmonary dysplasia. Option D, pulmonary hypertension. Neonate with history of frothing while feeding is suspect for tracheoesophageal fistula. Option B is the correct answer. Next question, question number 56. In which of the following condition a sausage-shaped mass is palpable in the right quadrant of the abdomen in infant? Options. Option A, Hirschsprung's disease. Option B, gastroesophageal reflux. Option C, intussusception. Option D, Crohn's disease. Palpable sausage-shaped mass on the right quadrant of the abdomen in infant is the features of intussusception. Here option C is the correct answer. Question number 57. In which one of the following condition there is an retrograde flow of urine from the bladder to upper urinary tract? Options. Option A, vesicoureteric reflex. Option B, posterior urethral wall. Option C, pelviureteric junction obstruction, and option D, phimosis. Here the question is a retrograde flow of urine, that means backward flow of urine from the bladder to the upper urinary tract is known as vesicoureteric reflex. Retrograde flow of urine is also known as vesicoureteric flow reflex. Option A is the correct answer. On to the next question, question number 58. In inborn errors of metabolism that causes premature destruction of RBCs. Options. Option A, G6PD. Option B, homocystinuria. Option C, phenylketonuria. Option D, celiac disease. And the correct answer, it is mainly due to G6PD. Option A is the correct answer. Glucose 6-phosphate dehydrogenase, that is G6PD. It's an enzyme which is present in the cytoplasm of a cell. Move on to the next question. Which one of the following is an early sign of ventricular shunt malfunction in infant with hydrocephalus? Options. Option A, high pitched cry, colic and pupillary changes. Option B, tense fontanelle, vomiting and irritability. Option C, anorexia and changes in pulse and appetite. Option D, headache, lethargy and loss of appetite. Question is, an early sign of ventricular shunt malfunction in an infant with hydrocephalus is tense fontanel, vomiting and irritability. Option B is the correct answer. Move on to the next question. Question number 60. The most common tissue involved in Hodgkin's disease is options. Option A skin, option B connective tissue, option C lymph node, option D epithelium. And the correct answer is, it is lymph node. Option B is the correct answer. Move on to the next question. Question number 61. Which one of the following provides positive airway pressure throughout the respiratory cycle? Options. Option A Venturi mask, option B non-breathing mask, option C oxyhood, option D CPAP. Our question is, which one of the following will provide positive airway pressure throughout the respiratory cycle? That is continuous positive airway pressure. Option D is the correct answer, CPAP. Move on to the next question. Question number 62. Earliest sign of rickets is options. Option A bow legs, option B craniotabs, option C malabsorption, option D anemia. And the correct answer is option B craniotabs. Next question. Question number 63. Which of the following term is used to denote the automatic repetition of the examiner's verbatism? And our options: option A echopraxia, option B catalepsy, option C echolalia, option D automatic obedience. Question is, the term used to denote the automatic repetition of the examiner's verbitation or examiner's words, that is known as echolalia. Option C is the correct answer. Move on to the next question. Question number 64. Perception occurring without external stimuli is called options. Option A depersonalization, option B derealization, option C illusion, option D hallucination. Perception without external stimuli is known as hallucination. Option D is the correct answer. Move on to the next question. Question number 65. A recurrent failure to resist impulse to steal objects that are not for immediate use is called options. Option A trichotillomania, option B pyromania, option C dyspomania, option D kleptomania. The question is, frequent urge to steal some object that are not useful for person. Okay, this is a type of impulse control disorder that is known as kleptomania. Option D is the correct answer. Move on to the next question. Question number 66. In which type of personality disorder increased sense of self-importance is observed? Options. Option A histrionic personality, option B narcissistic personality, option C borderline personality, option D dependent personality. And the correct answer is, it is narcissistic personality. Option B is the correct answer. Move on to the next question. Question number 67. Which of the following neurotransmitter is associated with waking behavior? Options. Option A noradrenaline, option B acetylcholine, option D dopamine, option D 5-HT. And the correct answer is option C dopamine, which is associated with waking behavior. Move on to the next question. Question number 68. Which of the following rule specifies that an accused person is not criminally responsible if his unlawful act is the product of mental disease or mental defect? Options. Option A Newton's rule, option B Durham rule, option C Curran's rule, option D mental health rule. And the correct answer is, it is by Durham's rule. Option B is the correct answer. Move on to the next question. Question number 69. Patients receiving monoamine oxidase inhibitors should avoid thiamine containing foods because it may produce options. Option A hypotensive crisis, option B agranulocytosis, option C indigestion, option D hypertensive crisis. Example for this monoamine oxidase inhibitors are phenylazine, mebanazine. All are antidepressant drug. While taking this medication, we should avoid thiamine containing food because it may cause hypertensive crisis. Option D is the correct answer. Move on to the next question, question number 70. The technique of psychological autopsy is useful in studying the causation of options. Option A, schizophrenia. Option B, suicide. Option C, personality disorder. Option D, drug dependence. And the correct answer is option B, suicide. Move on to the next question, question number 71. The duration of action of haloperidol decoynetis. Options: option A 24 hours, option B 2 weeks, option C 4 weeks, option D 6 weeks. Haloperidol decoynetis is a long-acting antipsychotic and its duration of action is 4 weeks. Option C is the correct answer. Move on to the next question, question number 72. Alcohol intoxication occurs when the blood alcohol level reaches above. Options: option A 50 mg per deciliter, option B 100 mg per deciliter, option C 150 mg per deciliter, and option D 200 mg per deciliter. Alcohol intoxication occurs when the blood alcohol level reaches above 200 mg per deciliter. Option D is the correct answer. And the next question, question number 73. Which one of the following is an example of therapeutic communication? Options: option A, I am not sure what you mean. Could you tell me about that again? Option B, I think you know everything than me. Option C, I don't have time to listen you. Option D, I think we should not talk anything about your relationship. Here, example of therapeutic communication. And the correct answer is option A, I am not sure what you mean. Could you tell me about that again? Question number 74. Which of the following intervention helps to improve the nutritional status of a patient with manic behavior? Options: option A, provide plenty of water to drink. Option B, provide high protein, high calorie, nutritious finger foods. Option C, provide only semi-solid foods. Option D, provide fatty foods. The correct answer is option B, provide high protein, high calorie, nutritious finger foods. Move on to the next question, question number 75. Which of the following condition is manifested with disturbed consciousness and cognition developing over a short period of time? Options: option A, dementia, option B, delirium, option C, coma, option D, sundowning. Disturbed consciousness and cognition developing over a short period of time is seen in case of delirium. Option B is the correct answer. Friends, here we are discussing previous year questions and answers. We completed 75 questions. Remaining 25 questions is there that we can see in the next video. If it is useful for your studies, please share my videos to your friend circle. Also subscribe my channel.